In Kenya today, a woman giving birth is a life or death gamble. This is Kenya News Update today. But here's the twist. The government is launching a massive, targeted assault on maternal mortality. And the strategy is so specific, it's focusing on just 26 counties. Coming up, you'll discover how 50,000 vulnerable mothers are getting free care, why global funding cuts are a ticking time bomb, and the secret weapon of 2,880 community health workers. Meet the young mothers in Turkana, in Mandera, in Wajir. For them, a trip to the clinic can mean days of travel. The cost? Prohibitive. The risk? Unthinkable. But President William Ruto just announced a seismic shift from the African Union summit in Addis Ababa. The government has restructured Kenya's entire health financing framework. The new Social Health Authority is expanding prepaid access to maternal care. So far, 50,000 vulnerable adolescent mothers are covered. Guaranteed. Antenatal, safe delivery, and postnatal services all paid for. And then something shocking happened. Another 38,000 mothers were onboarded. The promise? Cost will never be the reason a young woman is denied safe childbirth. In this day and age, Ruto said, it is unacceptable that women continue to lose their lives while giving birth. But here's what nobody's talking about. The recent reductions in global health financing are a silent crisis. Support to the UNFPA Supplies Partnership is dropping. This threatens to reverse every single gain in family planning and maternal care across the region. Kenya's response is a bold move towards self-reliance, a 40% local procurement requirement to build domestic capacity and shield from external shocks, and then the ground game. To ensure AQT, the government is concentrating resources in those 26 high-burden counties. They're delivering bundled medical equipment directly to the last-mile facilities to handle emergencies. But the real secret weapon isn't just machines. It's people. 2,880 community health promoters and 192 community health assistants are now deployed. These teams are the first point of contact in our villages. They're supported by 25 primary care networks that link local clinics to specialized hospitals. This is the human network fighting to save lives. But here's the part that will blow your mind. Kenya is moving from guesswork to precision. They're adopting the reproductive age mortality survey approach. This isn't about broad estimates anymore. This is about knowing exactly who is dying, where, and why. The government is building a national health intelligence platform, and they're inviting partners to help digitize it all. The implications are huge. Some say this targeted, data-driven approach is the only way to win. Others whisper that 26 counties is not enough, that the system is still too fragile. President Mata of Sierra Leone, standing with Ruto, put it bluntly. Africa has made clear commitments to end maternal deaths. The question now is whether we are prepared to turn those commitments into results, deliberately and consistently. The controversy? The clock is ticking. Global funds are drying up. Can Kenya's domestic push fill the gap before more mothers are lost? Do you think targeting 26 counties and betting on local production is the right strategy to save mothers? Drop your take in the comments. Subscribe to Kenya News Update today for more on this life and death mission.